De-influencing is all over TikTok right now. Let's take a moment to de-influence working in medicine. There is a phenomenon that occurs when you enter the hospital, specifically the operating room or a place where you would work, where you meet people who work in the operating room, like a PACU or an ICU. And in these spaces, a large percentage of the male physicians will look extremely Darren Shepherd-like. And I have pinpointed this phenomenon to the boxy uniform scrubs that are given to us from the scrub machine in combination with the surgical scrub cap. This combination is very flattering to the male head shape, hairline, and body. However, if you leave the surgical suite, you appear in the real world with your colleagues. Oftentimes, you are surprised to find they actually look like this, which is fine. It's just not the same as what you had previously imagined before. The second thing we must de-influence is the myth of heroic saves. I'm doing this since 2013. I was an ICU nurse in 2013. I've been a CRNA since 2017. I've worked in trauma anesthesia. I've worked in cardiac anesthesia. I've worked in OB anesthesia. High risk, high volume, high everything. The amount of Grey's Anatomy-like moments that I've had in my career, they come up, they happen. But they come up like a couple times a year. Most days in anesthesia, I'm doing a lot of this. Watching the monitor, titrating fluids, giving some medications, and listening to a lot of beep, beep, boop, beep, table up, table down. Although I will say, in some of those cases, were pretty darn cool. I even had a patient survive a carotid blowout once. That was like pretty wild. But most days, beep, beep, boop, beep. De-influencing the myth of the on-call room. We do in fact have call rooms where we get to lay down and sleep when we are on call shifts, like 24-hour call shifts. Some residents can work for even 36-hour shifts. They're typically not bunk bed style, although I have seen that before. There's typically never an opportunity for multiple people to be in the call room at the same time. Usually we're taking turns. So the odds of you having enough downtime to be getting frisky, pretty much a never. Also, the cleaning staff have access to the call rooms and often just like barge in on you. So that would be a pretty risky move.